Hello. Today we have as our guest Dr. Sharmila Pararikar. Uh, she is a physiotherapist and she has been working in this field for past 30 years. She has completed her education from GS Medical College, Mumbai. She has worked in several hospitals as well as her private practice, including the prestigious and renowned Sanjeevan Hospital. Currently, she is the head of department of rehabilitation in the Nanath Mangeshkar Hospital. Besides the actual work in this field, she has also written various articles in magazines and newspapers, and she has also delivered various speeches on radios. So let's commence our interview with the very first question that comes to one's mind. Ma'am, what is the field of physiotherapy? What does it mean?
Hello. Basically, the branch of physiotherapy is something which is required in most of the conditions. To put it very simply, whenever a patient has some sort of a problem, it may be a fracture or paralysis or anything, a sports injury, once the patient is treated, you have to get this patient back to function and normality. That means the patient has to start doing things the way he was doing before the injury. And this process of getting the patient back to functional normality is where the physiotherapist really works. The scope of physiotherapy and the definition of physiotherapy also, I think, is now taking into consideration a little more area, in the sense that initially it were always the patients who were treated, but nowadays even people who are into sports, professionals or amateurs, are the ones who are per se not patients in the sense, but they are training for some very specific skills, and even these people have to be trained for that specific skill, and that is again another area where a physiotherapist does have a lot of role to play.
Ma'am, how can one get admission to this course of physiotherapy, and what is the admission procedure?
See, the people who wish to do physiotherapy have to primarily do their 12th standard in science stream. If there's going to be a state exam like you have for Maharashtra state, Karnataka state, so you have to basically appear for these exams which are common for medical dentistry physiotherapy. So you appear for the exam, and depending on your ranking, you are called in for a counseling, and then you have to give in your choice of college depending on where you are getting in. So you have to be basically a 12th with a science graduate and appear for these entrance exams.
Can you tell us about the duration of this course and also the curriculum?
So basically nowadays this course is of 4.5 years, which of it the 6 months are the internship period, which is a complete clinical training period. Of course, even right from the first year or the second year you start handling the patients. The last 6 months is pure clinical training. This course compromises of all subjects which are studied by any medical student. Of course, the weightage for each subject will differ, like whatever is important for a physiotherapist will be learned in more detail, like medicine, neurology, anatomy, and topics like maybe ophthalmology or psychiatry would be something which would be passingly addressed to, because there you may not be as required as where you are in other fields. After your graduation, you can go in for a postgraduate degree, wherein again you have to appear for an entrance exam, and the whole process repeats as it is repeated for an undergrad level, which for some states at present is around 3 years, and few states still have a 2-year postgraduate diploma, course. And if you want to go still further, then of course you can go in for a PhD.
To lead a successful career in this field of physiotherapy, what are the skills and abilities one should master and develop?
Well, I think nowadays, if you take any profession or any field, it's well understood that it's not just the professional training which is important. You require many more skills and abilities if you are to be really successful in a particular field. Coming to this particular field, I think what is one of the most important thing is that the person needs to have a lot of patience, because here you are going to handle patients who are going to take a lot of time to recover, who have to be coaxed at times, who have to be counseled at times. And if you become impatient, the patient is not going to be very comfortable with you. You also need to have an innate empathy for the patient. If you have that with you, it helps, I think, because yes, certain things can be learned professionally, but if you have it within you, it's going to be much, I think, a positive thing. Another thing is, physiotherapy is not a desk job. You are not sitting in one place and doing. So you need to have a little bit of more physical strength and capacity and stamina, because when you're going to handle patients who are themselves disabled, and when you're going to train them, at times there might be occasions when you have to take a lot of their weight onto you, and at the same time you have to see that they don't fall, they feel secure with you. So you need to have that sort of capacity within yourself, that you can handle that patient and you are keeping the patient safe. So it does demand a lot of physical activity. So you need to be a person with a little more stamina also. So I think these two or three things are of utmost importance. You need to be soft spoken also, which might be acquired. I don't say that it has to be, but whenever you are handling a patient, because as I said, in our field, we have patients with whom you are doing the same thing over and over again. So it can become boring for the patient, for you at times, and you're not going to see immediate results. So to do the same thing at times can even at times be a little irritating for the patients. So if you are harsh with the patients, and if you don't really understand what he is going through, probably he might lose confidence in you. And everything in physiotherapy works on rapport. So if you don't have a good rapport with your patient, it may not work well.
Ma'am, once you complete your education in physiotherapy, what are the future prospects and opportunities for career?
Well, one has to really remember that when you go in for any professional course, I would say, but especially so in today's world, the medical side, you need to have a lot of patience before you really start getting something significant. Because I'm especially saying this because nowadays you have a lot of people going into the engineering side, and you hear a lot of people saying at the age of 20, 21, 22 that their packages are in 3 lakhs and 4 lakhs. So at that point of time, maybe you, from this side, you are not even earning 1 lakh. So even when you go in for this course, be ready for such sort of things, otherwise you'll be disillusioned. Because you have a lot of people saying that physiotherapy has a lot of scope, you can make a lot of money and that, and then if you don't see that sort of a thing, it's very likely that you might become disillusioned. So you have to first remember that you need to have a lot of patience before you really set into a career, which holds true for I think any professional, be it a dentist, a medical person, even an architect or somebody of that sort. Another thing is, the good aspect of this profession is that you have a lot of career, I wouldn't say career options, how you go about working in this field. Like, you can be a person who is into academics and research. You can be a person who is working in a hospital setup. You can be a person who has just a private practice, or you can have a combination of hospital setup and a private practice. Or if nothing of this works, you have a lot of patients who need physiotherapy but cannot be brought to the hospital or a clinic because of their disability. So there's a lot of demand for people to go home and visit these patients and treat these patients. So you can even get a lot of home visits. As I said, all these things need to develop. But like, if you go with an idea that I pass out and from next day I'm going to get 10 visits, no. Yeah, you have to have that sort of network. You need to have those skills. You have to develop rapport. It can be one-to-one. Like, if I have been treated by a physiotherapist and then I know of some patient, I'll recommend that, okay, this person came and treated me, so you can call in this person. So you, in that sense, with this particular profession, you can have a lot of flexibility. Like, if I say, right now I have some other commitments, I need not do a 9 to 5 job. it is not the only thing I can do. I feel that I cannot do 9 to 5. I can say I can just work for as a part-time, or I can just work in a clinic, or maybe do home visits, that sort of a thing. So anything is possible.
There's a notion in the society about physiotherapy that it is the field of the ladies. So how far is this true?
Well, I would say yes. You do have a lot of girls coming in this for this particular course than boys. Though the scenario is changing over the period of time. When I was a student, we used to have just one boy for 3 or 4 batches. Now you have at least maybe 4, 5, 6, depending on the batch, of course. I'm talking maybe this number per a group of say 30 students or something. The scene still remains like that because I feel it may not be having that much of a glamour probably. Another thing is I'm not very sure as to how I can answer this question for you, because why it happens I cannot say. But I would definitely say that this is one branch where boys can really come in and work, because as I said initially, it requires a lot of stamina and it's a lot of physical work. And now with changing trends, with a lot of sports coming in and fitness thing coming in, you have, if you like, all Indians watch the TV and we are all ardent fans of cricket, you must be always hearing this thing like the physio being called in on the field and those sort of things. So this is one area where a physiotherapist is always required. And a team goes from one place to another, so the therapist has to travel with the team. So that is something which usually a girl doesn't do. It's the boys who can go overnight and stay with such teams. So I think it's a good branch for the boys also to come in. But yes, it does remain that there are more girls than boys. Yes.
Uh, can you tell us the pros and cons of the field of physiotherapy?
I think we have already talked a little about it, but to maybe recap, as I said, one thing is, let's talk about the positive sides first. The thing is, it is a course where you can sort of create a niche for yourself depending on your requirements. Like, you can work in a clinic or maybe have flexi timings, and you can change these things which will not happen with a corporate. Like, if you have a good job with say ICICI, you can't think of giving up a job of 50,000 one fine day and say that I will do something, because it's difficult to find. But with physiotherapy, if you are ready for such compromises, you can do it. Like, you can say I can work for a few years like this, and then probably from there I take over, or I can say change my area of interest. Like nowadays it is people are specializing in just neurology, in just cardiac, in sports medicine. So even you can sort of change from one area to another to keep up your interest if you want, or you can just develop in one area. So I think especially when it comes to a girl, it becomes a very positive thing, because if she has to manage her house and a profession, this is a very ideal scenario, because we all know that nowadays logistically most of us don't have so much of a backup system to look after many things. Coming to the negative side of it, the flip side of it is, as I said, to start off you're not going to really earn money. Yeah, it is going to require a lot of patience. Another thing is, the physiotherapist have to remember, like many a times ours is basically a referred practice to quite some extent. There are changing trends. There are people who come directly to a physiotherapist, but primarily ours is a referred practice. So many a times you have to take a second position in the treatment plan, depending on your rapport with the the referring consultant. But many a times it doesn't go well with the people, like they feel that I know what I'm doing, and why this person is interfering. So you have to be ready to play second fiddle at times with depending on the situation. But I wouldn't say there are so many negative sides of it. I think every profession has its, but all in all, I would say it has more positive sides than negative sides. Yes. Yes, I think all depends on how you look at a problem.
Today, with the changing situations and reducing physical exercises, do you do you see a growing need for physiotherapy in the society?
Well, I would say yes, what you said just does hold true to some extent. But even with that, I think the awareness that physiotherapy exists and it can help has grown uh, many folds. So that is probably the reason why people ask more for a physiotherapist. Or you, as I said, you have a lot of people walking into physiotherapy clinics or in our hospitals who come for a direct consultation. They say that we don't want to go to the doctor, we want to come to you first. So again, I think it becomes our responsibility also to use that discretion as to where I have a role to play and where a doctor has to play a role. So if I have a patient who walks in and he feels that he doesn't need a doctor, but I feel that yes, he should be seeing a doctor first before he comes to me, I should be doing that instead of first doing physiotherapy and then sending the patient back. As I said, because the awareness has increased a lot. Coming to the need, like things like paralysis, fracture, and cardiac problems have always been there. Yes, but it is the need that by doing physiotherapy you have a better chance of recovery. That awareness has increased, and so the demand is more. And as you very rightly said, a lot of people nowadays, you have two spectrums. One are the ones who do a lot of exercises, who also end up with a problem. Let me make it a point here. We have a lot of people coming in with gym injuries because they are doing excess of exercises or wrong exercises, so they end up with us. And on the other spectrum, you have people who don't do any exercises, or they are into jobs which require a lot of sitting or wrong postures. So again, they have to come in. And as a very at the very beginning, as I said, that even people in sports professionals or amateurs, you have a lot of people who just play on weekends, but even they play a sport, so they are the ones who need to be trained. Even I would say pregnant ladies, like there was maybe 20 years back or so, there was never this understanding that a lady who is pregnant needs to exercise for better delivery and keeping up her tone, and she needs to exercise after delivery to get back the tone, which is a very in thing these days. Like you go to any obstetrician, you will have most of the obstetrician having a physiotherapist attached to them who trains them for all these things. So all in all, I think it's the awareness part which is more important. But yes, they are in demand, I would say.
Thank you very much, ma'am. Today you have come here and you provided us with so much information and insight about physiotherapy. I thank you very much
Thank you.
from the bottom